Hey there, I want to talk to you guys today about posture. People who have bad or even insufficient posture is generally viewed as them being maybe fatigued or lethargic or lazy even. And on the surface, that's one negative aspect of having bad posture. What's probably more important as it relates to posture is the physical and even psychological aspects or consequences to bad posture. Postural assessment winds up being a very, very important thing for us to assess the impact that bad posture, particularly forward head posture, as we sit in front of computers for long periods of times or long commutes, the forward head posturing puts an enormous amount of excessive stress to the spine, the discs, the joints, the nerves, and the muscles. And these really should be identified through a postural assessment. In this office, we use a computerized digital assessment of the posture. And a postural assessment can be looked at similar to a sphygmomanometer, where you check your blood pressure as an indicator of other things that may be going on. Or if we check our blood glucose, our blood sugar levels, that monitor indicates to us other potential problems underneath. A good postural assessment helps us understand some of the areas of the spine and the joints that have excessive stress to them and what can be going on underneath. It's very common for most spine-related problems not to be so much from acute injury or trauma, but from sustained stresses and in a way a repetitive trauma to the spine as we have bad posture throughout the day in and day out. This is a printout of one of the pages from our postural assessment, where we take two digitized pictures with markers and we get to see the imbalances in the key areas of the posture, as well as the additional stresses in some of the spinal regions for that individual. And then, of course, recommendations will be made as it relates to therapeutic exercises and some therapies and different postural exercises that can be done for the person on their own. We hope you partake.